So we are live now on YouTube. I just wanted to, I just wanted to introduce everybody here to Erin Hayes, who is a now going to be soon intern in urology and was a medical student with me. And so we are going to answer your questions about applying to urology residency.
Yeah, so we've just been answering some questions on the Instagram Live, which we're also going live on. And if you missed them, you can always check them out. They're saved for 24 hours. But we got some questions in advance also that I think we wanted to kind of touch on first. So the first one is kind of a general one. What percentage of urology applications get accepted? And we did some research very briefly, and we found, so overall it's between 69 and 91% of all the applications get accepted. This past year it was 83%. And then I mentioned this already on the live, but we've gotten some questions about IMGs. So that's between 17 and 58%, most often between 20 and 30%. This last year it was 32%. So
yeah, and then so there's a couple questions here on the YouTube chat. The first one is how much surgery is done in urology? And so urology is a surgical subspecialty, but the beauty of urology is that it is both medical and surgical. And so it depends on which subspecialty you go into or general urology, but you will typically have a blend of both clinic and taking care of long-term patients as well as surgery in your week. So it's a really lovely balance of both of those things. And the kind of surgery you do is extremely variable, and it can be from anything like minimally invasive procedures in the office, like doing cystoscopy, to maximally invasive, big open abdominal surgeries. We also do robotic surgeries and endoscopic or minimally invasive surgery where we get stones and laser stones. So there's a lot of different variety and diversity in urology, which is why I think we love it so much.
Yeah, I think that was definitely one of the things that drew me to urology, was the diversity of surgery. And, you know, there's something in there for everyone.
Yeah. And then the other question I have here is, what was your medical training experience like? So I'll talk on that because I've completed my medical training. Yeah. I think that medical training was extremely rigorous, and it's a time where you're completely focused on learning urology. And so the first few years as a junior resident for me was extremely busy. We were in the hospital a lot with very few, holiday weekends off, and it was extremely busy, but you learned a lot, and you were really active in taking care of patients in all aspects of urology. We talked about this a little bit on the Instagram already, but taking care of patients on the floor, in the OR, in the clinic. And so that part can be very busy because you're usually a very small service taking care of every issue that has a urologic issue in the hospital. And then as a senior resident, you do more operating. And so you're in the OR most of the time, which is actually a really fun time because you're learning, you're getting really good at your skills. And it's just a wonderful time. And so a really important thing I think to look at when you're applying to urology is, are you going to like the people you work with? Because you're going to be with them all the time. And then fellowship was amazing. I loved fellowship. It was a time where you feel really, truly special. You get to work with your attendings as colleagues almost, and you get to do what you really want to focus in on. So it's really a lovely experience. Do we want to go to some Instagram questions?
Sure. So this one is a little more general, but it says, what kind of volunteer and clinical experience have you had before applying to medical school? So for me, the main clinical experience I had was actually, I worked in a physical therapist office for 3-4 summers. So it was, adjacent to doctor, but I learned a lot there. I learned a lot about anatomy there, which I think was really important. And I actually, when I was entering med school, I thought I wanted to do orthopedic surgery. And so that was a little more akin to that. And then throughout medical school, which happens all the time, I changed. But so that was the main clinical experience, along with just a little bit of shadowing friends, parents. And then volunteer experience, I did this thing where we tutored students in science in local public schools around where my undergraduate was. Those were the main things I did.
I do want to make sure we take some time to address the COVID specific issues that were brought up beforehand. So Erin, if you want to go through some of those questions, and then we can answer them to the best of our abilities. And please realize this is a new time for all of us, and we're kind of figuring out how to navigate it ourselves, the urology programs, the urology applicants. So we're going to give you our best advice, but again, take it as advice, and we may not be 100% right. So just be careful. Just be careful, and it's not be all end all.
Yeah. So the first question we got, these were questions sent in before, is especially since there are no aways this year, what do you think is the best way to show interest in a particular program or geographic area, especially if the program does not have an online social presence or virtual aways?
Yeah, so I think that this is all coming. I think the programs that don't have as much of a virtual presence will have some way, or will develop some way to reach out to residents. And it's still pretty early. If you think about it, it's June and applications aren't due until September. So there's still time for programs to develop either virtual electives, even if there's not that many out right now. And there's also still time for programs to figure out ways to reach out to students. And everyone's going to figure out their own way. We're doing that at my program. And so there's definitely going to be ways for you to interact with programs. So for now, my advice is to just sit tight, try to get as much information by talking to people who've applied to urology recently, residents, if you know them. Those are the best ways right now. And then as time goes on, this will evolve and change.
Yeah. I know the program I matched at, is already working on, like Dr. Malik said, ways to kind of interact with potential new residents, and it is a learning time for everyone, but I think in the end it'll all work out, and it's not a time to panic. Everyone's in the same boat. They're gonna figure out a way to make it happen.
Right.
So the next question we got is, what are some questions that you feel can best help get an accurate feel for the culture of a certain program? So for me, I think a lot of the ways you can get a culture is just not even through questions, but by the way the residents interact with each other, which I think I do understand will be a little bit harder to gauge on Zoom and these virtual interviews. But some of the questions I asked were, especially for the residents, do you guys hang out on weekends? Are you like trying to gauge if they were friends in real life? And then just kind of the general questions, what are your favorite things about this program? And a lot of people will say the other residents and the people they work with, and they'll go into a little bit more detail about that and how they support each other. So I think that that's a good way to kind of gauge that.
Yeah, I think other questions, I used to really like to ask, what do you feel like you're wishing you had in your program, and what do you feel like are the biggest strengths? And I think talking to the residents is really where the key is, because they don't have, they want to just be honest with you. They want residents who are going to be who they're going to get along with, because they're going to be working with them very closely. So they generally want people who want to come and fit into the program. And so asking questions to them and just being open and honest about what you're looking for is going to be helpful.
Yeah.
I got another question here. If you hadn't chosen urology, what field would you have gone into? Erin, you want to go first?
So I mentioned I was interested in orthopedic surgery when I entered med school. So maybe orthopedic surgery or possibly dermatology. Similar to urology, I think there a lot of times is you come in with an issue and then you fix it and then they get to leave. And I like a lot of what I liked about urology was the more minimally invasive, smaller procedures. Like the time I knew I wanted to do urology was when we were irrigating a bladder, and it was so like satisfying. And so probably dermatology.
I really seriously considered obstetrics and gynecology before deciding to do urology. And then when I did my surgical subspecialties, I actually liked ENT and urology. And I decided between those two. And really the advice that I got was, think of the thing that certain specialty does as the most mundane thing, and see if that's something that you don't mind doing. So for urology, it's Foley changes, and ENT, it's trach changes. And I was like, oh, I don't like this. So I'll do the Foley changes.
That's funny.
Do we have questions on Instagram? I have more over here, but I want to make sure we're.
Yeah, make sure if you guys have questions, I don't have any more on Instagram, so.
The other question is urology in high demand. And so urology is a very competitive subspecialty. There are not that many residency programs available. Erin, do you know the number? I think it's like,
I can look
so
it
there's
up.
not that many residency programs available, and it is a very competitive subspecialty. Although in the last year, the match rate was 83%. So of all the people who applied, 83% matched. And I think, you know, whether that's there are a few more programs coming up, but it is challenging to start urology programs, and so it is still a very competitive subspecialty. And if you decide to go into urology, spend some time meeting with your med school advisors and your urology clerkship director to really learn if you're a good competitive candidate for urology. And then another question I got was, how can foreign trained doctors practice medicine in the US? So that's a complex, long answer, but really you need to take all your step examinations to be certified and then complete your board examinations in the United States to then practice in the United States. So it is a lot of work, but it can be done.
So just to go back to the number of programs and positions, so there are 142 non-military urology programs, and then within those programs, there are about 325 positions. So, you know, some programs have one resident per year, some have two, some have three. I think like the most I've seen is 5 per year. So it's a small program within a small specialty.
Yeah. So I see a question on Instagram, which is there any discussion of limiting applications or interviews? And so there is actually discussion of this. However, that will not be happening this year. So this year, there will be no limitation on the number of applications that you can send in and the number of interviews, at least to date. Things may evolve, but as of the last meeting that we had with the Society of Academic Urologists, there was no change. And so I think that this is, you know, valuable to some degree because it is getting very exorbitantly expensive for students to apply because they're applying to 70, 80 programs, which is expensive. And prior to this year, we're going on multiple interviews and spending money to go travel and stay in hotels and things of that nature overnight. So I think we want to limit that because ultimately you don't need to apply to that many programs to match. So that's to be determined.
Yeah, I think that that's one of the positive changes that is going to come out of this crazy COVID time is just the amount of money that you spend on interviews and the amount of time is a lot. And also I think it disproportionately favors people who can afford to do that. And so I think that with kind of being forced into virtual interviews, there's going to be some positive changes in the long term, hopefully.
Yes. So the other questions, I have some more here. I don't know, there might be one there, but there's one is we'll focus on the urology questions, and if we have time to some of the non-applicant questions, we'll get to them for sure. The one question is, have you seen a surge in applicants or decline due to COVID-19? And this remains to be seen because applications aren't in yet. I would guess that there's going to be more. However, the Society of Academic Urologists has strongly recommended that students limit their application number to 30 programs. We'll see if what happens with that.
Well, and my thought is honestly, overall, the number of applicants applying, I have heard from many people, and this is not, you know, I have no hard data on this, but I know a lot of people, especially for the more competitive specialties, are considering taking years off. Doing research because they're not sure how applying during this time is going to affect their chances. So yeah, it does remain to be seen, but I definitely think that it's going to change in one way or another.
Yes. Do we have other, here's another one. I know some of my classmates are considering taking a research year. What are your thoughts on that, Erin?
Well, so personally, I did take a year off. I took a year off between my 3rd and 4th year. It was not technically a research year. For those of you who don't know, I worked at the Dr. Oz show for a year. I did do research for the show, but it was not putting out original papers. But for me, it was such a great decision. I do not regret it at all. Just like social, like no, regardless of what I did during the year, after third year, I felt a little bit burnt out. I didn't take a year between college and med school, so I went straight through. I did feel a little bit tired, a little bit burnt out. I was ready to kind of explore what was out there in the world. And I really think it, solidified that I wanted to go into urology. It gave me a little bit of time to sit on that and bask in it. And I was 100% sure with my decision. I got such a great experience. I got to live in a different place. I got to experience new things, meet new people. And so just even beyond what you do, I think if taking a gap year is something that you're interested in, go for it. I think that also if you do something that makes you stand out and is a little bit different, that for me in my experience helped my application so much. So yeah.
Yeah, so I think personally, if you want to do a year off, it should be one because you also want the time off, as Erin felt like she wanted, and it can help your application in the sense that you can develop relationships with a research mentor. You can do research, you can publish research, but it won't change your board scores and the scores on your rotations. And so those things are still very important. And so you have to balance that because if your step one score, which is going to change, obviously step one is going to be pass fail. But at this time, if your step one score is quite low, it's not going to, that's still somewhat of a marker of if you're going to get interviews or not. So I have another question. If you apply for urology and do not get accepted, do you have to accept another match, or can you keep working as an intern and try again next year? This is a great question. Yeah. So if you don't match in urology, if you have a backup plan, and some people do, although I think it's a lot of work to apply for urology and another subspecialty. So I don't know anyone that did that, but I know people do that. Then you can get into that match potentially. However, most people will take another year and apply the following year for urology because that's your best chance of getting into urology. If you decide to take a spot in as a prelim year in surgery or something else, it's harder to get a second year spot in urology because those don't open up quite as readily as there are just applying again. I've definitely interviewed applicants who've interviewed for the second time, and it doesn't actually detract from their application at all. So if you love urology and that's what you want to do, you should keep going for it.
Yeah, I agree. I know a couple of people this year who didn't end up matching. And as far as I know, most of them are just going to try, they're going to do research or do something in the year, not do an intern or prelim year and then apply again the next year.
Mm-hmm. Do we have other questions on our Google Drive? I do have some kind of non-application questions, but I figure we'll focus on the application questions first.
Yeah. So this one says, in hindsight, after completing your residency, would you have changed any of your priorities for what you were looking for in a program? Is there anything you felt like you under or overvalued?
Yeah, that's a great question. So I think I can probably answer this a little bit better since I'm actually done with that process. And I think I overvalued the reputation of the program in making my rank list. So, there are US News and World Report rankings of programs, and I think that skewed my bias in looking at programs. And so I would think a program is really great because of that, and not necessarily because of all the signs that I saw, for example, when I went on an interview. And so not to say that those aren't great programs, but they weren't necessarily great for me. I ended up matching at a program which I think was a perfect fit for me. And I actually loved my residency. And I think that there is something to be said about just how that day, how you feel like you interact with the people there. And obviously now this year you'll have virtual interviews, so you won't get that experience. But in years coming, hopefully we'll still continue to have in-person interviews. So I think going to a program is very, very useful. But I think feeling like you fit in and feeling like you like the people you're going to work with is so valuable. And I probably undervalued that. Other things I think is like research time. It seems like a big important thing when you're interviewing, but I think unless you are like gung-ho researcher and have done a lot of research and that's something you're sure you want to do, it's not entirely mandatory. So some people put a lot of emphasis on that. I didn't personally, it didn't matter to me in making my rank list personally. And then I think location is another thing that I overvalued, but I think it was rightfully so. My husband and I had made the decision together of where we wanted to live. And even though you don't have as much free time, it's really important to live in a place you like.
Yeah, I mean, I haven't completed residency obviously or even started, but the things that I totally agree, and the things that I based my decision on was, for me, location was the main thing. Again, I have a significant other that can only live in certain cities, and so that was really important to me. And then this is something that I tell people. So I noticed on my interview trail, a lot of people were taking notes on the research time or the money you get for loops or whatever, or even, I mean, I do think the call schedule is important, but I decided to not take any notes and just go strictly based off my gut, you know, where I felt the most comfortable. And I'm so glad I did that. I think that, you know, that helped me so much. It didn't cloud what was important to me, which was like the general vibe of a program and the people that I wanted to work with.
Yeah, like making those spreadsheets, which some people
Yeah.
do.
Seriously,
I mean, I think there's
number
certain
that.
things that are valuable, like how many residents a year that you might forget, because that is, you know, seeing how big a program is might impact your decision. But like the other stuff, yeah, you can make like a rank list of what's important and do these complex formulas. But like at the end of the day, I matched where I think back now was like the place I liked the most, even though I didn't rank it number one based on other factors. And it worked out perfectly. So I think ultimately going with your gut is extremely valuable.
Yeah.
Um,
I have more questions.
I have another question. Do you have one?
Not on Instagram, but I have the
Okay.
Google Doc, but you can go.
I have one. This is, other than board scores and clinical grades, what do programs like to see on a CV? Is research essential? So I think research is not essential. Absolutely not. We want to see things on your CV that show that you have some leadership, some ability to work on a team with others, that you have some initiative. And so that can be variable. Like it can be that you went and took a year and worked at the Dr. Oz show, or it can be anything that shows that you are committed to something, that you are willing to see it through. And so research is important and it can be helpful, but it's not mandatory at all. I think it's nice to have it, but having one project that you're working on is totally fine. I don't think I had any published papers by the time I interviewed, but I had some projects that I was working on, and that was fine. It's just something nice that people can talk about and they might find interesting, but there's other things on your application that people will find interesting as well. And it's variable person to person.
Yeah, I was the same way. I had no published papers or anything, but I had projects I was working on. And, you know, I didn't get interviews at the programs that are super, super research heavy. Although I did get interviews still at programs that have a full year of research. So a 6-year residency that has a full year of research. But yeah, I didn't find that it affected my application.
Yes. So let's see, do we have any more? I think. Do you think a smaller or larger group residency is better? It's a great question. I went to residency with 3 residents a year, which is considered kind of a middle tier residency. Most programs have so there are some programs that are smaller with 1 or 2 residents a year. Then I think the majority of programs are probably 3 a year. And then there are some larger programs with 4 or 5, although I think that's all increasing a little bit. Everyone's trying to get more residents because we're just, we're typically limited in capacity in urology, and we could always use more help, but it's hard to get more residents. So I've trained at a 3-year program, 3-a-year program. I did fellowship at I think it was 4 or 5 a year program, and then here where I train, I have 2 a year. And so I think that honestly, I've been to all different programs. I think it really depends on the kind of faculty you're working with and the kind of experience you're getting. I didn't feel like a huge difference in having a big program or a small program. I think it's like how well you get along with people and how well you get along with the faculty there and what kind of experiences you have. Like, for example, at my program, we have only 2 a year, but they rotate with us. They rotate at the VA hospital, they rotate at a private hospital. And so they get a really great experience despite being a small residency, and they're super tight knit. So that's the value in having a small program, is that you're super close.
Yeah, I agree with everything you said. So I had a question. on Instagram that says, and it may not be applicable this year, but how do you feel that step one going past fail will impact the urology match?
So that's a tough question because we don't know. I think that it will not change. It's a hard question. I think that there will be, you will still need to be a competitive applicant in the sense of all your clerkship scores need to be on very, very good. If you take step two, that still needs to be a good, strong score. And so I think those things will change in that way, but it's hard to say yet how each individual program is going to really change based on that.
Yeah. Do you have any?
You made a video on this, right, Erin?
Yeah. So obviously I did some research just based on, at this point, it was right after the announcement was made. And so it was mainly people talking on Twitter, honestly, which the medical community on Twitter is very active. I think it's good in the fact that it will maybe even the playing field for people who just have a really bad day on step one, making it pass fail. I think that in a lot of ways, so it might make just step two might just replace step one, and that's what people, that will be the cutoff point for interviews and everything. Also, it might negatively impact people who don't have a lot of opportunities at their school, so might not have a lot of research opportunities, might not have a home program in whatever, like say urology, they might not have a home urology program. And so not having that, if they do really well in step one, that obviously boosts their chances, when a lot of times there's stuff that would negatively impact it. So yeah, I don't know. I think it's up in the air and it hasn't happened yet, but I'm hoping that none of that negative stuff happens and that it will just even the playing field, but I imagine it'll take a little while to get there.
I think for those of you who are maybe not familiar, so the step one score is for some programs and not all, and I can't speak to every program, but some programs use it as a benchmark. They use a specific number to give interviews or not. And I don't think that that's necessarily the way things should go. But when you get hundreds and hundreds of applications, sometimes people need a screening point. And so I think that will change and people will be forced to review applications more wholly. And I think that's the whole goal behind it. So I think the sentiment behind it is positive, and I hope, again, as Erin mentioned, that this will be a positive thing.
I have some more on the Google Doc if you.
Yeah.
So this is a little more general, but what made you choose urology over other specialties? And we kind of touched on this. But again, for me, it was the diversity and then the people in urology. I felt like this is what I always say, my people.
Yeah, so I say that all the time too. I say it's finding your tribe. So in medical school, it's finding the people that you click with and that you feel like are like you, like-minded, and you will. And it's funny because everyone kind of ends up where they're supposed to be and with like-minded people. I think the other thing is that I try to tell people, there have been a couple questions about women in urology, and I think that the match rate for women has been quite good. I think, Erin, you might have those numbers, 86%.
Yeah, it's higher than the overall match rate.
Right. So women are matching in urology quite well. And I think that so right now there's 10% women in urology practicing, but there's about 26% in training. And so I think that will continue to increase. And I think it's great. I don't think there's any real, in every field in every part of medicine, there are biases against women in general. I'm not going to give a big story about that here, but I think in general, I don't think they're any different in urology. I think that urologists in general are trying to do a better job of trying to address these biases and disparities in gender and race, and hopefully that will continue.
Yeah. So I have another question that I think is actually a pretty good one. So tips for first years wanting to do urology.
That's a good one. Okay, so I'll start.
Yeah.
So I think that if you are interested in urology as a first year, I've had a few first years reach out to me to do research, and that's a great way to get involved. Not even if you are so enthused about research, but it's a great way to have an ongoing connection with someone and to continue to like interact with them on a regular basis. And so that's one real benefit of doing research. And always when you do reach out to people and you want to make mentorships, kind of make your expectations known and make sure that they're making their expectations known to make it a really fruitful discussion back and forth. And then I think even just asking to come shadow in clinic is very reasonable. And I've had people do that with me. And I think it just shows that you're excited and interested, and it helps. Like I remember actually I shadowed a urologist who is now a colleague of mine as a first year as part of our required rotation. But it was my first introduction to urology. And later when I was trying to decide if I wanted to go into urology or not, I thought back to that and was like, oh, that was really nice. And so that helped quite a bit.
Yeah, and then I would say on just a more of a statistical level, or I don't know, but just again, we've mentioned urology is a pretty competitive specialty. So I would really focus on keeping your grades up, keeping, studying for, this is beyond first year, but your step 1 score, even though I know it's becoming pass fail. And making sure that you set yourself up in a good position so that you're not super stressed during the match. You have a good chance of matching. The best piece of advice I ever got was don't ever limit yourself based on grades or based on scores or anything. Always be able to keep your options open. So that goes for anyone.
Yeah, absolutely. Other questions? Let's see. I don't have much to add. I think that we've kind of hit that there. Let's see.
Yeah, we're coming to the end of our questions, guys. So if you have any more that you want answered, make sure to send them in on the Instagram or the YouTube.
So I guess someone asked, what is our part about working in the medical field? So urologists, we take care of the urinary tract. So that includes the kidneys, the tubes that drain the kidneys, the bladder, and the urethra where the urine comes out from. So we're like the plumbers of that field, and we take care of anything that goes wrong in those areas that can include cancers, stones, strictures or narrowings. We also take care of the pelvic floor, which is my area of expertise. So taking care of things that impact the pelvic floor, incontinence, bladder leakage, bulges. We take care of erectile issues or penile issues as well. So we take care of a wide range of things in urology, and we do the medical and surgical management of that.
I think that was one of the things I really liked about urology as well, is that you get to kind of see a patient from beginning to end. So if someone has hematuria, which is blood in their urine, you immediately get consulted. So you kind of get to see the issue, diagnose it, and treat it, which I liked, kind of that continuity.
Yeah. And there was a question on a bias for pain for patients with stones and endometriosis. That's a tough question. I would say that, there is a lot. I've actually made a video on bias in medicine, so you can check that out, reacting to John Oliver. There's definitely a lot of bias in medicine that needs to be addressed due to implicit biases and things of that nature. So yes, there is definitely bias, and we are, I hope, working to improve that. So I kind of want to go back to the application process. Erin, what was your most memorable part of the application, and what is something you would do differently now if you were to do it again?
I would not have applied to as many programs as I applied to. I definitely over applied. I think, and I'm going to be honest, I think I applied to 100 programs, which is too many. It's too many. I think I maybe scheduled a few too many interviews. I kind of pushed myself to do as many as I could do unnecessarily. I ended up matching at a place I did an away rotation at, so especially for me, who I loved all of my away rotations and my home program and was ranking them all very highly. I definitely think I overextended on that front and spent a lot of money on that. But yeah, I think that it's important to not limit yourself on the number of applications and not set yourself up for failure, but also kind of gauge your application. And if you don't think you need to apply to 100 programs, don't do it.
Yeah, I think for me, I didn't apply to nearly as many, but it was many years ago. So I don't think it was, I think things have changed and there's a lot of pressure, like within group pressure within medical students to yeah, to basically like do more. If all your colleagues are doing, 70 applications and you're like, oh, I should do 70 too, right? And so I think there's a lot of in-group pressure and that wasn't there. Although I did have a lot of students with me apply, I didn't match somewhere where I did an away. I matched in the city where I did an away, but not at the program. And I think that it was, I know that we're not going to be able to have in-person aways this year. It was useful, but I think that people have started to do too many away rotations and it kind of loses its novelty. It also loses, I mean, you can only be enthusiastic for so many days and so many months. So I think it would be nicer to shorten aways and to do less of them. I did two aways and one at home, and that was a lot back when I applied. I don't regret it though, because I learned a lot from doing them and I really enjoyed it, but I would never do three. I would never do three.
We did 4 aways and I did the same. So I did 2 aways and then 1 month at home. And I was exhausted after those aways. I mean, because you're enthusiastic all the time. You're really trying to stay. It's just mentally, you want to impress people. You want to put your best foot forward. And it can be mentally exhausting. And so I think that you definitely cannot sustain that for that long. And then it's not even useful, especially a lot of the point of doing aways. So a lot of the point of doing aways is you want to see the program and see if you like it, but it's also to get a letter. You want to get a letter from your aways. And so I knew some people who did aways after the letter deadline happened. And they said, unless it was a program that they really, really wanted to go to and that they couldn't get scheduled at an earlier time, they regretted doing it.
I have another question here. Do you think there will be any second looks at programs? So there are actually, the Society of Academic Urology actually does not allow second looks. And so I don't know if that's going to change for this year. They haven't said definitively to my knowledge. But as of right now, second looks are not allowed, but this is obviously a very unique situation. And so that may change. I think if there is no resurgence of COVID and they become allowed, I think it might be a really nice way for people to get a shortened experience at a program, whether it's a couple days or a week or whatever. But we'll see what happens.
I think this year, especially second looks might be valuable. My personal experience last year was I'm very glad there were not second looks. I think it adds another layer of, okay, you're going to I think people feel as if they have to go, which the idea is you definitely don't have to go. It's just for the applicant, but people feel like they will be considered more highly if they go to a second look, and they will stretch themselves time-wise and money-wise to go to a second look, which I think, in the years that you can visit programs for interviews was not useful. But I think this year, yes, everything's off the table. Everything's changed.
Yeah. Okay. Other questions? So Erin, do you feel like after the match process that you matched where you wanted to be or like where you're supposed to be?
Yeah, I truly, truly believe that everything happens for a reason and you end up where you're supposed to be. And I ended up in my hometown, basically. It enabled me to not have to, this is just like little things, but not have to stress about moving during COVID, not have to stress about any of that. I'm excited to be with the people that I matched with. I feel already part of the team and I haven't even started yet. And I've just heard the same from a lot of people, even people who didn't end up matching at their first choice. People, I just feel like everything truly happens for a reason.
Yeah, I will say, I think, I think that the one thing I will say that was so great out of residency for me is, my husband's a New Yorker. He had never left New York. And when we left New York for my residency, it changed our lives. We actually got to see another city. We experienced life outside of New York, which for anyone who's from New York can understand that you feel like you live in a bubble and that's all there is and there's nothing else outside of it. And we've actually enjoyed it, and which is why we decided not to go back to New York right away. Maybe in the future someday, but right now we are very happy in Baltimore. And so I think there's wonderful things from every experience, and you just have to have the right viewpoint. I have a question. How important are board scores compared to presenting your work ethic at away electives? That's a great question. So I think that your work ethic at away electives is super important. Again, this year there will be no away rotations, but in general, when these do become aways again, I think they will impact the work ethic, will impact your letters from that program, and will impact your ability to shine at that program. But it's at this current time, the board scores are probably more important, because the letters, unless you do an amazing job, are not very different person to person, especially if you've only spent a month with that person. And so I think it's, your letters from your home institution are more valuable because you spent a lot more time with them and they've invested in you and they want you to match, and there's a lot more there. So.
Yeah. We got an Instagram question, which we already answered. So we will not, repeat ourselves over again.
I think we're going to wrap up in the next 10 minutes, 9 minutes or so. So if you have questions that you've been holding off, please ask them. And I think we can continue talking about, just our experience in general. What else? So I think we can just, for the time, tips for virtual interviewing was something we talked about. So how can you make your virtual interview process more appealing and more enticing? Erin, maybe she has a YouTube video on this, but she can talk a little bit about it here.
Yeah, so I did some research on this, and the big things that I found, and I'll just go over them quickly. Test your technology before you start. So we had make sure that your webcam works, your audio works, that everything works. I would say my other piece of advice is I still would do everything the same as if you were going to an in-person interview. I know the whole joke on Zoom is, oh, you're wearing a nice top and sweatpants, but I do think that it changes your whole demeanor if you're dressed and done up like the way you would have when you go to an interview. I mentioned this in my video, but also for women, if you're wearing, if you were going to wear heels on the interview, I would still wear them because I think you sit differently. I think a lot of things can affect that. So I would do that. I would make sure your background is a little bit more of a neutral background. So I wouldn't have, if you can, a bedroom or something in the background, I would try to do something a little bit more neutral, so you're not giving like a full look into your personal.
What are your thoughts on virtual backgrounds?
I am not a fan of virtual backgrounds, but I do think that if you have no other option, it's a great way if you're not comfortable with your background. But I think that if you can just find like a blank wall or something to sit in front of.
Yeah, I agree. I think the virtual backgrounds, when you move your hands, it kind of gets fuzzy. But if you really can't find a nice place, to sit, then maybe it's better. Like if you really have no space that looks clean behind you, then it's probably a reasonable option. But just make sure that it is appropriate. Like, I don't know if you should be in space or something when you're doing your interview.
So